I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. How important is your doctor's attitude about your treatment? Does a reassuring bedside manner make a difference? This is the People's Pharmacy with Terry and Joe Graydon.
The relationship between doctor and patient is extremely important. That's something healers have known for thousands of years. But modern healthcare puts a premium on efficiency and technology. Have we lost sight of the value of kindness?
How does your doctor react when you bring in printouts from a Google search? With access to the National Library of Medicine, patients can look up the latest information on their conditions.
Coming up on the People's Pharmacy, your calls and questions about how your doctor's attitude has affected your health.
First, the news.
In the People's Pharmacy health headlines, generic drug companies are under increasing scrutiny for collusion. The attorneys general of more than 40 states are suing 20 generic drug makers for fixing prices. The assistant attorney general and key investigator for the state of Connecticut says this is most likely the largest cartel in the history of the United States. It involves 300 drugs, including antibiotics, arthritis medications, HIV treatments, blood thinners, cancer drugs, and contraceptives. According to the lawsuit, American consumers have lost billions of dollars because they were overcharged. It's alleged that executives met face-to-face at industry conferences and social events to divide up the market and determine prices. The generic drug companies deny wrongdoing and state that they will vigorously defend themselves against the charges.
Generic drug shortages and high prices have led 800 hospitals to band together in a nonprofit venture to produce affordable generic medications. Civica RX is designed to accomplish what generic drugs were always supposed to do: provide quality medications at reasonable prices. The company has announced that its first products will be the antibiotics vancomycin and daptomycin. Civica RX has contracted with Xelia Pharmaceuticals, based in Copenhagen, to supply the drugs for 5 years. There are currently over 200 different medications in short supply in the United States.
The Johnson & Johnson Company has reached a $1 billion settlement with plaintiffs who had received the company's metal-on-metal hip implants. The Pinnacle implants were found to be defective because they allowed metal to build up in the body. Allergic reactions, pain, bone loss, and tissue destruction were among the adverse reactions. Another lawsuit that made news this week involves the weed killer Roundup, known scientifically as glyphosate. A jury in California awarded one couple $2 billion. In their suit, they'd claimed that their non-Hodgkin's lymphoma cancers were due to exposure to the herbicide. The Bayer company will appeal the verdict, claiming that Roundup is safe for human health.
Many studies have shown that the DASH diet can help people lower their blood pressure. Now, researchers have found that individuals who follow the DASH diet guidelines most closely reduce their risk of developing heart failure. DASH stands for Dietary Approaches to Stop Hypertension, and the diet is rich in vegetables, fruit, and low-fat dairy products. It has little red meat or desserts. Sugar-sweetened beverages and alcohol are off-limits on this diet. The study included nearly 4,500 participants in the multi-ethnic study of atherosclerosis. These individuals were under 75, and they answered detailed questionnaires about their usual diets. During the approximately 15 years of follow-up, the scientists noted which volunteers were diagnosed with heart failure. Those who followed DASH guidelines most closely were 60% less likely to have such a diagnosis compared to those whose usual diets were least compatible with this approach.
Electronic medical records have been widely adopted by health systems and doctors' offices around the country. As a result, patients can access appointment information, pay their bills, check their lab results, and in a few cases, read clinical notes about their condition. The idea of open notes originated at Beth Israel Deaconess Medical Center in Boston several years ago. It was supposed to make the doctor's insights available to the patient. New research supports the value of open notes. An analysis of this program after 7 years found that 98% of the nearly 30,000 patients who responded to an online survey found that online access to visit notes was helpful. 73% said that reading the notes helped them take better care of their health, and 66% reported that these notes reminded them of the plan of care. And that's the health news from the People's Pharmacy this week.
Welcome to the People's Pharmacy. I'm Joe Graydon. I'm a pharmacologist.
And I'm Terry Graydon. I'm a medical anthropologist. Anthropologists have noticed that healers around the world rely partly on reassurance and a supportive approach to help people who are ill or in pain feel better. American medicine relies heavily on proficiency and productivity and pays less attention to patients' perceptions.
New research suggests that a doctor's attitudes can have profound impacts on patients' health. To learn more, we turn to Carrie Leibowitz. She's a Stanford Interdisciplinary Graduate Fellow and doctoral candidate in psychology at Stanford University. She's working in the Stanford Mind and Body Lab.
Welcome to the People's Pharmacy, Carrie Leibowitz.
Thanks so much. It's great to be here.
Well, thank you for joining us on the People's Pharmacy. You wrote a really cool article with your colleague, Lauren Howe. Can a nice doctor make treatments more effective? This was in the New York Times. I was just intrigued by this. So, I think everybody wants a skilled doctor, a capable doctor.
And lots of us want a nice doctor as well.
Yeah. I mean, why is it important to have a nice doctor? What difference does it make?
So actually, there's a lot of research showing that a strong patient-provider relationship, so if you're a patient and you see a provider that you trust, that you feel like is not only competent, but is warm and friendly and really understands you as a person, that actually positively benefits health outcomes. So it can make the impact of treatments more effective. It can make your experience of going to the doctor more enjoyable, which in turn affects what happens in your body when you're being cared for and when you're being healed. And this has been shown, in a number of different conditions. So there's even one study looking at whether an empathetic consultation before surgery improves healing outcomes after surgery. And that research finds that, yes, just an empathetic consultation with a surgeon before surgery actually improves your healing after surgery and reduces the amount of pain medication you need. And so I think one thing that people think is that, a nice doctor is just sort of a bonus, or it's very secondary to having a skilled doctor. But what we're really starting to understand is that these things go hand in hand, that competence and warmth go together, and that having a nice, friendly doctor can really augment that physician's skills.
Are we talking about something on the order of the placebo effect here? That if the doctor is reassuring, that really increases the likelihood you're going to get a good result from the medicine he or she is prescribing?
Absolutely. So we are talking about the placebo effect here, but we're not talking about the placebo effect in terms of responding to nothing, responding to a sugar pill or some inert treatment. We're talking about what really is the placebo effect. Well, it's the power of things like our expectations. It's the power of things like our associations when we go into a doctor's office. It's things like our mindsets, things like the social context of interacting with a doctor that we trust. And so it is about the placebo effect, but what I do in my work and what we do at the Stanford Mind and Body Lab is really try to unpack what are the forces that lead to placebo effects and how can we harness them even in conjunction with active medications and treatments.
Well, I want to know a little more about one of the studies done at your Stanford group. It involved 76 participants. They got what's called a skin prick test. It's often used to determine whether people are allergic to stuff like mold or mildew or cat dander or whatever. What happened, and why did the way the doctor interact with the patients make such a difference?
So for this study, we brought patients into the lab and we pricked them, as you mentioned, with histamine. And this causes a red, itchy, allergic reaction, a small bump called a wheal. And then for some participants, the doctor just looked at their arm and didn't say anything. So they were physically examined, but the doctor didn't really tell them anything. And then for other participants, the doctor looked at their arm and said, from this point forward, your rash and irritation will start to diminish and you'll feel better. And for those participants who heard just that one sentence of reassurance from the doctor, they actually had fewer symptoms. They actually felt less itchy after hearing that reassurance in response to this histamine skin prick. And I think that this is really interesting because one of the things we are trying to do in this study is see, okay, we know that the physician's words are powerful and we know that they can boost the impact of treatments and the effects of medications. But what about when there isn't medication, right? What about when you go to the doctor's office and you just have a cold virus or you have a bruised rib or a sprain, and there's not really anything for the doctor to do but tell you to wait, there's nothing to worry about, and that you'll feel better on your own. Does that actually do something, or was that doctor's visit a total waste of time on everyone's part? And this research suggests that actually just hearing that reassurance from the physician might speed up healing and make patients feel better faster.
Now, you've written that provider words influence the efficacy of even our most powerful drugs and treatments. Can you tell us about a similar study in which actually groups received an antihistamine cream? How did the patients react?
Yeah, so in this study, we were actually looking at the ways that physician demeanor would impact response to a cream for the same histamine skin prick. So in this study, participants came in and they were given that histamine skin prick, which caused a small allergic reaction, but then they were also given a placebo cream. So this is a cream that has no active ingredients, but in some conditions, the provider told them, you know what, this cream is actually an antihistamine and it will make your rash and irritation better. But what we also did there is we manipulated what kind of doctor participants interacted with. So in some conditions, the doctor was warm and friendly. She called the patient by name. She asked them how they were doing. She made a lot of eye contact. She was also competent. She performed all the procedures flawlessly. And in other conditions, she was less warm and less competent. So she didn't look patients in the eye. She asked very blunt questions, not really feeling like she was getting to know the person, just like she was, trying to go through her checklist. And she sort of fumbled a little bit. The room was more messy. So there were some cues that maybe she wasn't as competent. And what that study actually found was that what the provider said about the cream, whether it would help make the allergic reaction better, only made a difference when the provider was warm and competent. And so when she was warm and competent, the placebo cream, which had no active ingredients, actually did make the rash and irritation better. And again, here we're talking about both this concept of warmth, niceness, friendliness, trust, and competence. And so we're not saying competence isn't important. Everybody wants a skilled, competent doctor, and they should. But I think oftentimes we overemphasize the competence and we don't think that the warmth actually really matters for health outcomes. And in truth, these things go hand in hand and together produce the best outcomes.
So it sounds as though it's not just what the doctor says, but also how she or he says it.
Absolutely. So it's really not only about, what the doctor is telling you a medication is going to do, because if you don't trust a doctor, if you don't feel like this doctor understands me, my body, my needs, my goals, then when a doctor says to you, oh, this is going to work for you, are you going to believe her? Are you going to feel like, oh, she really knows what's right for me? But when a doctor who you feel like really has taken a little bit of time to get to know you, has really signaled that she cares about you, not just as sort of a bundle of symptoms, but as a whole person, and then she says, this treatment's likely to work for you, you might be more likely to believe that doctor, to really trust that that's going to do something. And then boosting that effective expectations, boosting that psychology around the positive aspects of that treatment can actually have real consequences on how that treatment works.
So, Carrie, what is the take-home message for both health professionals as well as for patients?
Absolutely. So for health professionals, I think there are so many physicians out there who know this in their bones, who know that taking the time to connect with and care for patients on a human level matters. And I think that that's why a lot of physicians got into medicine in the first place. But unfortunately, I think there are a lot of things in our system like short visit times or what can get billed for in the electronic medical record that de-incentivize these things in care and in practice. And so for physicians, I just want them to know that these things do make a difference for your patient's health outcomes. So all the people who are doing this already and who know that this is so important, but aren't sure if, the system really tells them that it matters, it definitely matters. And similarly for patients, we had so many people reach out to us after the story and say things like, I switched from this doctor who was supposed to be the best because I felt like, he or she just didn't really understand me, or they weren't that nice, or they weren't that friendly, to a doctor who I actually really liked. And now I feel validated in having done that. And so for patients, I want you to know that having a doctor that you trust, that you feel like respects you, is not just you being picky or overly sensitive or focusing on the things that don't matter, because those things really are important for your health. And so prioritizing having a physician who you feel like you have a good relationship with is worth doing.
Carrie Leibowitz, thanks very much for talking with us on the People's Pharmacy today.
Oh, my pleasure. Thank you for having me.
You've been listening to Carrie Leibowitz. She's a Stanford Interdisciplinary Graduate Fellow and a doctoral candidate in psychology at Stanford University, working in the Stanford Mind and Body Lab. You'll find a link to her research from our website.
And we invite you to join the conversation. Has your doctor ever said something that made a big difference in how you felt? Our lines are open for your calls and your questions. The number is 888-472-3366. You can email us radio@peoplespharmacy.com.
After the break, we'll take your calls and hear your stories about how your doctor's attitude may have affected your health.
Is your doctor a cheerleader? And do you find that helpful or annoying?
Give us a call. Share your thoughts and stories.
The number again, 888-472-3366, or email us radio@peoplespharmacy.com.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's KAYA Biotics.com. Use the discount code PEOPLE for $10 off your first purchase.
Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. If you would like to purchase a CD of this show, you can call 800-732-2334. It's show number 1165. You can also place your order online, peoplespharmacy.com.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today we're talking about doctors' attitudes and their influence on clinical outcomes. Can your doctor's positive attitude improve your health?
You can join the conversation. Have you ever found a message counterproductive? Our lines are open at 888-472-3366 or send us an email, radio@peoplespharmacy.com. That number again, if you'd like to join the conversation, 888-472-3366.
Joe, we have email from Faith, and she writes, "My doctors at Memorial Sloan Kettering were absolutely the best. Besides being extremely skilled and excellent at their profession, they were warm, caring, and funny. We had many laughs together. They did not introduce themselves as Dr. So-and-so. They introduced themselves by their first names. My plastic surgeon even joked that for my breast reconstruction, he would give me a Faith's Special. Because of my doctor's down-to-earth and outstanding warm behavior, I had a wonderfully quick and easy recovery. Can't remember feeling much pain and took very little pain medication. After major cancer surgery, I was out walking 4 or 5 miles 3 weeks after surgery. My surgery also included an approximately 12-inch incision of my latissimus muscle used as part of the reconstruction. Kudos to my doctors at MSKCC." So that from Faith about how her doctor's positive attitudes really helped with her recovery from important cancer surgery.
What I find so interesting about Faith's message is she really valued the sense of humor of her physicians. And I remember my mom, who went to an incredibly smart, very competent, very capable, brilliant doctor, but he wouldn't laugh at her jokes.
This is a problem.
And my mom had a kind of
quirky
is the right term, quirky sense of humor. And she basically fired him. She said, if he won't laugh at my jokes, I'm not really interested in interacting with him. And she found a doctor who would laugh at her jokes. He had his own quirky sense of humor, and they became really good friends. It wasn't just a doctor-patient relationship. They felt a real sense of warmth. She liked going to the doctor, and it was really wonderful having that opportunity to observe how this kindness, this niceness, this interaction could make such a profound difference. And it had an impact on her ability to heal from a variety of conditions.
Absolutely.
If you'd like to join the conversation and share your story about interacting with your physician, please give us a call at 888-472-3366. If our lines are full, you can email us, radio@peoplespharmacy.com, or via Twitter. We're at People's Pharmacy.
And we're going to the phones to Columbia, South Carolina. Marcy, welcome to the People's Pharmacy. Please tell us about your experience.
Oh, yes. I had been standardized patient at the medical school here for 9 years, and now I'm 78. But I was always vital, and I thought, I don't need an older doctor. I didn't need an older doctor. Friends were telling me about going to geriatricians. And then I heard one of our geriatricians speak to a group of us, and I said, that's who I want as my doctor. And I'm so impressed because they listened. They genuinely listened. When I went the first time, the social worker relaxed, asked me all the questions, and I knew the answers because I'd been a standardized patient, but that's beside the point. She was lovely, and then I met half an hour with the nurse, and then I met the doctor, and no one ever made me feel like I should hurry up. And it's just a solace. But the reason I wanted to call in is because I think that's a kindness in itself. We always know that when we go to doctors that we're going to be rushed. They're rushed because they have a lot of patients. But I also realize that, for instance, in Albany, New York, where my sister is, they don't have geriatricians. And as our population ages, I think that's just cruel because it makes such a difference. And also, sense of humor, I agree with your mother. I have to have a doctor laugh. I try to put the doctor at ease because I feel empathy. But if they don't laugh, then I worry.
Absolutely. Marcy, you said something that I think maybe not everybody knows about. Can you explain to us what you mean when you say you were a standardized patient?
Okay, it meant that when I retired, I did this. I impersonated a patient with a situation, and the medical student would come in and ask questions to discern what the problem is. And very often they would ask about your mental competency. And so maybe I would have to draw a picture of a clock at a certain time. And or maybe they would just ask me dates about what the day is.
So you were helping.
Make sure that I was clear.
So you were helping to train the medical students.
Exactly.
Well, thank you so much for your call. We really appreciate it. And, I think one of the things that I take away from this is that it was a team effort, Terry. Because what Marcy said is, first in came the social worker.
Yeah.
And then in came the nurse.
Yeah.
And then in came the doctor. And they all worked together to make me feel reassured and supported. If you have a story to share, if you'd like to join the conversation, again, our lines are open at 888-472-3366. Have you ever felt that you weren't heard or that you didn't have a good relationship with your doctor, and how did that impact you? We'd like to hear both sides of the coin. Again, that number, 888-472-3366. Email us, radio@peoplespharmacy.com.
Joe, we have email from John about nurses' demeanor. He says, I had a nurse who told me at age 35 that if I were able to quit smoking by 39, I wouldn't have done irreversible damage. This had a huge impact. I did quit by 39. I've been quit for 20 years now. She didn't preach to me. She just simply advised me in a caring way. It seemed to matter to her that I was hurting myself by smoking. So that made a huge difference.
And it's probably the most valuable thing that anyone can do for their health. I mean, stopping smoking is like fundamental, but sometimes it just takes a health professional to give you that encouragement to make that step. Where to next, Terry?
To Apex, North Carolina. Steve, welcome to the People's Pharmacy. Tell us your story, please.
Hello, how are you?
We're well. What's going on, Steve?
Yeah, so I had a sudden cardiac arrest.
Ooh, that's not compatible with life.
No, it's not.
But here you are.
I was down about 4 minutes, then put into a coma for a couple days in life support. But I had a cardiologist. I walked out, and he's associated with Duke, Dr. Parsons. And the guy really got to know me. And he wanted me to know him a little bit. I know he has a dog. I know his dog's name. So it made a big difference. I went to see him about once a week for almost 12 months.
Wow, you had a close relationship with this doctor.
Yeah, well, yeah, and but he's the one who fostered it, with my wife also, because my wife would go with me, and he just became someone. It made the whole world difference. I've had, at that time when I had that cardiac arrest, I was also type 2 diabetic, high blood pressure, I had a lot of doctors, but this guy was different. So I believe what you're saying on your show today, because I've been listening. I listen all the time, by the way, but it really does make a difference when you have a doctor who knows how to talk to you.
Tell me how it changed you, how you're doing today. What's going on with your heart? Because cardiac arrest, I mean, that's basically your heart's not pumping, and you are, every second you're getting closer and closer to death.
Well, that's true. I mean, we all are. But in my case, so what I did is, and partially because of this doctor, I changed my entire life. I changed what I ate. I changed how I exercised. I changed everything. I don't know. I want to say I was like 24% pump, something like that. Now I'm over 50.
Well, Steve, that is such good news, and we are so glad that your cardiologist stepped in to really use his caring attitude to help you change your life for the better. That is wonderful.
And we hope there are more doctors like the one that you have just described, because it does make a profound difference for you, not just you, but also your wife and your family. Thank you for the call. Bye-bye.
Okay. Well, you all have a good day.
Thank you so much. Terry, let's go to Charlotte and talk to David. He's going to tell us a little bit about a massage therapist. Hi, David. Welcome to the People's Pharmacy. Your story, please.
Yes. Earlier this week, I had a traumatic experience doing tree work, which threw my lumbar area out of kilter.
Ouch.
And it was so painful. And as I'm trying to recover from this, I thought, what do I need to do? I think some help would speed the recovery along. And I thought of a chiropractor and then also of this Rolfing expert with whom I have a prior experience of several years ago. So I called her, name is Beth, and said, do you have an opening, which she made for me? And I went in, and we chatted about past things, and then she got me on the table and just began the very gentle manipulation as she had in the past, starting at the neck, and then she says, okay, well, your problem is at your waist, so she started at my feet and gently massaged and said, oh, well, here, this is a bit tight here, and continued to work to the place. And the long and short of it is, about an hour and a half later, she says, well, I think that's what I can do for you. And the pain basically had gone away. I had great confidence in her abilities from previous experience, and it just paid off. When I heard the beginning of your program, I thought, I need to call Beth and ask her to listen to your guest, because it just seemed that it fit the way she dealt with me.
David, thank you so much for that. That is a wonderful story.
And Terry, as someone who has had back problems for almost my entire life, I can attest to the fact that a massage therapist who is skilled and supportive and reassuring can make a huge difference. It certainly has in my life.
Absolutely. Joe, we have an email from an anonymous person. Shout out to the patient actor. I am a student at the medical school here, and I would like to say they have helped significantly in coaching us on what works well and how we get along on a personal level with patients. Our school stresses the importance of having a high level of understanding and empathy for the patient. We're not allowed to move further in training if we fail at being empathetic, or at least demonstrating improvement in this area. Humor, empathy, and human touch can sometimes be the best and only medicine. So that is for Marcy, who was the patient for the medical students to learn on.
Terry, I have an email from B, and B says, I love using the patient portal in communicating with my doctor. His nurse also has access to my emails and is prompt in replying. So much time is saved on my end and also in the doctor's office. Positive improvement in healthcare. And I think that's a really important point, because now we do have email access, often through the portal. There are a lot of programs out there. And, sometimes a reassuring word by email can make a difference, too.
Absolutely. Although I think it works better if you have a prior face-to-face relationship.
Absolutely.
We go to Raleigh. Tina, welcome to the People's Pharmacy. Tell us about your experience, please.
Hello, everyone. I have two short stories. At least I'll make them short. I have a thyroid disease. I was diagnosed with it some time ago, and when I was first diagnosed, I had to go to a specialist, and we had somewhat of a language barrier. And I wanted to be involved in, my treatment and everything. And when he was describing to me what I had to do, one of them was to begin to take medication. And I asked him, what would the medication do? And he said, it'd make you feel better. And I kept asking him, I tried to ask in different ways, like what will happen metabolically or physically inside my body, what was going to happen. And he just kept saying, it'd make you feel better. And that was really very frustrating for me. And there was no team or anyone that could help with that language barrier. I recently, in the past 2 years, had to switch doctors because I moved to North Carolina. And I explained to my doctor that I wanted to be part of wanted to be part of my treatment, and that I would like to do things holistically if possible.
And Tina, we're almost up against a break. What happened with the new doctor?
Well, he just ignores everything that I say, and he forgets that he has given me things to do, and it just is not.
Well, it sounds as if you had a very frustrating experience, and maybe it's time to consider another doctor. Terry, do you have some suggestions for Tina?
Well, I do. I mean, to get the support that you need, you may have to tell the doctor what you need. You need to learn to ask for what you need and think about your goal for the visit before you even walk in. Request the support you need, whether it's by email, online, by text, or by phone call. So that's an important piece of it.
It is. We're going to take a break, but when we come back, we're going to take more of your calls at 888-472-3366.
You're listening to The People's Pharmacy with Joe and Terry Graydon.
This People's Pharmacy podcast is brought to you in part by Verisana.com.
Verisana Lab offers home health tests that allow you to monitor your hormones and health conditions. You can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's uppercase PEOPLE. To learn more, go to Verisana.com. That's Verisana.com. bedside.com. Welcome back to the People's Pharmacy. I'm Joe Graydon.
And I'm Terry Graydon. If you would like to purchase a CD of this show or any other People's Pharmacy episode, you can call 800-732-2334. It's show number 1165. You can also find it online at peoplespharmacy.com.
The People's Pharmacy is brought to you in part by Kaya Biotics. Probiotic products made in Germany from certified organic ingredients. That's Kaya biotics.com.
For your doctor to understand what you want, you need to be able to describe it. Access to information can be critical in determining your course of action. Have you looked online? Have you shared the results of your search with your doctor? But you sometimes need to say to the doctor what exactly it is that you need. And Kaylee emailed us a story about that. This person says, I had an on-the-job accident severing the muscles in my hand.
Aye, that's painful.
It's scary. When I met the surgeon workers' comp sent me to, I called them to demand a new surgeon. I was so scared because he was cold, mean, and robotic. A week later, I'm prepped for surgery, and he comes in to run over the procedure. He's a completely different man. For the next 8 weeks of recovery, his RN didn't know who he was because he would just joke, laugh, and have a great time when I came in. I regained 100% use of my hand, which he hadn't expected. He and his team were amazing. So there is a situation where Kaylee said, I need this doctor to act differently, and he actually rose to the occasion.
That's wonderful. You know, Terry, you mentioned looking online for information.
Which is something we all do. Our doctors don't always appreciate it.
Well, and sharing that information with your doctor. So to learn more about potential reactions to a patient's questions, and particularly to internet search results, we turn to Dr. Michael Stang. He is Associate Professor of Surgery with Duke University Medical School and Chief Quality Officer for Duke Raleigh Hospital. He's an endocrine surgeon and a surgical oncologist.
Welcome to the People's Pharmacy, Dr. Michael Stang.
Thank you for having me.
Dr. Stang, we recently had an opportunity to talk with a student who will soon become a doctor, Carrie Leibowitz. She actually studied nice doctors, how doctors' communication style affects patient outcomes. We also received an email from one of your patients singing your praises, saying that she searches out for the best surgeon, and apparently you fit the bill. And she also said you didn't make fun of her for bringing pages printed from her web search to her appointment with you. So tell us why it's important not to make fun of patients and how your communication style allows for, a good relationship with your patients so that they don't feel in any way humiliated or belittled.
Sure. I think one of the most important things that I've learned over the last 19 years of being a doctor and surgeon has been the importance of not just fixing a problem. That was my main driving force when I became a surgeon. I liked to fix problems. But it was really in understanding patients, the patient experience, and what they're feeling through the process. Fear is a very strong emotion, and it's one I deal with daily, with the anxiety of knowing that there is something wrong, that potentially surgery is needed to fix it. And in practice, over years, it's become very important for me to develop that connection early on in the clinic before we even approach the subject of treatment. And in my case, it's usually surgery. And learning what's driving a patient's angst or fear, and really then approaching each one of those topics in time so that they can feel empowered with that information. Really the goal being that as a patient is moving through the process or as they get closer to surgery, they have a level of peace or comfort because they've gotten that information. And so there's less surprise. And that's really what's motivated me over the last 2 decades of practice.
I'm especially interested in this idea that the patient who contacted us said she had a high level of calcium in her blood, didn't get any answers from her primary care physician, went online and found that it might be a parathyroid problem, brought you the printouts from parathyroid.com, and you accepted that she had found this online. A lot of doctors don't want to see printouts from the internet. What makes you different? Or are you not different? Maybe I'm getting it wrong.
No, from my standpoint, I'm not intimidated by information that's being brought in from the internet. The internet is an incredible source. There are sides to every avenue of information that we get. Some of the information on the internet is more geared towards marketing.
Yeah.
And it's okay. Usually there is some truth in that information. And I then just don't necessarily belittle that information that the patient's bringing to me, but instead point out what I find to be very factual, and then add to it in my practice what is really a part of the healing process and parathyroid surgery in this case. So I wasn't at all intimidated by it or if patients are bringing information from the internet. And usually once the whole picture is laid out, I find that there's really very little sense of discrepancy based off of what we are seeing as physicians or surgeons versus what may be available on the internet.
We're often told that when studies are done about interruptions, that the typical visit will entail an interruption often within 30 seconds or less of the patient starting to tell his or her story. How do you avoid that trap?
That's a great question. Something I was taught early on in my medical school training of we had classes on empathy, classes on how to simply ask open-ended questions.
Such as?
Not necessarily, do you have stomach pain? Do you have a history of high blood pressure? Simple yes-no questions, but more or less, what is your understanding of this problem? In this case, it was a hyperparathyroidism. What is your understanding of that? And then just allowing enough time for that to mature and develop. Some patients don't understand. And for those, I spend most of my time trying to paint a decent picture of the biology behind it so that there's that it makes sense as to why then are we doing surgery to fix it versus a patient that has a lot of information already and is more interested in filling in the gaps or the questions that have been keeping them up at night for the last 3 weeks while they're waiting for their appointment.
Dr. Michael Stang, thank you so much for talking with us on the People's Pharmacy today.
Absolutely. Thank you.
You've been listening to Dr. Michael Stang. He's Associate Professor of Surgery with Duke University Medical School and Chief Quality Officer for Duke Raleigh Hospital. Dr. Stang is a surgical oncologist and an endocrine surgeon.
Have you ever taken internet search results to a doctor visit? Were you and your doctor able to discuss what they might mean for your case? Give us a call with your questions or your story. Our lines are open at 888-472-3366. You can send us email. We're at radio@peoplespharmacy.com.
In just a second, I have an email to share, but I think we need to just remind people that you have to keep in mind the amount of time you have for your office visit when you take in something from the internet. Don't take in everything you found, just the most important stuff. Select it, prioritize.
Boil it down to the essence.
Right, and something that's specifically relevant to your particular case and your particular question, and do pay attention to the source of the information. So, Joe, here's the email we have from Ben. He says, a quality interaction with a physician shaped my life a year ago. I am a transgender person and throughout this journey have consistently had trouble finding kind and empathetic physicians to help me. No one ever tells you that when you transition, some doctors will no longer be comfortable treating you. Last year, I was hospitalized for a mycoplasma infection, and I was in the hospital for 5 days. I was fully expecting my care to be as frustrating as all of the care I'd received since my transition. Instead, every single doctor and nurse was kind, empathetic, and encouraging. This was the single most life-changing experience I've ever had. I now volunteer at the hospital that treated me so kindly, and I'm applying to medical school next May. I hope someday to be the kind, quirky, and compassionate physician that so many people need.
Oh, that's so wonderful, Terry. The idea that, having such a positive experience could change the trajectory of your life, that's pretty cool. Here's an email from Fred. Read the book by Joe Dispenza. You Are the Placebo. That's the title. You Are the Placebo. He describes how a physician's words to patients can directly affect healing. So it's much more than having a warm, fuzzy conversation, but rather a powerful effect that can enable healing or disable it. Let's go to Marilyn, Terry, in South Carolina. I think it's Spartanburg. Is that where you are, Marilyn?
Yes, that's right. Hey.
What's going on?
Well, I was diagnosed in 2005 with lupus, fibromyalgia, and rheumatoid arthritis, and I have an excellent rheumatologist. And, in fact, I have excellent doctors, and it's taken me a while to train them because I don't hesitate to speak out and ask questions. I've had doctors who would sit working at the computer and saying, well, hey, what are you doing this summer? Going anyplace interesting? And to which I would reply, I never go anyplace, but what about this, this, and this? So I don't let them get away with anything.
Well, I like the notion, Marilyn, that you have to train your doctors and get them away from the computer so you can actually interact with them.
And this is a long-term relationship. So. But I do have, as I say, an excellent rheumatologist, but he is an hour away. And at one point I thought, well, it's awfully difficult. Well, not super difficult yet, but it's difficult for me to make that trip 3 or 4 times a year. So I thought, well, I would see if I could find a rheumatologist who was in my town here. And there were a couple, so I was sort of referred to this woman. And I was shocked. I mean, she was not interested at all in my past experience with my other doctor. And I sort of figured she knew what she was doing or whatever. She insisted on starting in the beginning and giving me all the tests. And she was positively rude. And when I tried to ask questions, at one point she even said, well, I'm sorry, but you're taking away time from my other patients. And I don't think I was, being out of line. But what I'm wondering is, why don't they screen people for this sort of thing?
Well, Obviously, they sometimes do, as we heard from the medical student who related his experience or her experience with a standardized patient. They do now try to teach students in medical school how to behave properly. But you are the screener. Ultimately, you are the one who is determining whether this doctor is appropriate for you. And it sounds to me, Marilyn, as though you've determined which doctor really fills your needs best. So good for you.
You know, I think, Terry, more and more medical schools are screening their applicants for attitude as well as for competence and brilliance.
I think that's appropriate and important. Christopher in Springfield, Missouri, I'm sorry we have very little time. Please tell us your story.
I'll be as quick as I can. Thank you for taking my call. I had a previous doctor, other than what I have now, who literally saved my life. He was so in tune with me that when I had developed some abdominal pain, he knew something serious was wrong, and he really urged me to get to the ER, and it turned out that my appendix had ruptured. And he knew my fears about the hospitals and so forth, and he went so far as to fight with the CEO of the hospital and the legal department and social services to make sure that a hospital employee sat with the person I'm guardian of while I was having surgery. And I've never had a doctor fight for me like that, and he was probably the best doctor I will ever have.
It sounds like it, Christopher. Thank you so much for sharing that story.
Now, Christopher, I had a somewhat similar experience last summer. I contacted a good friend who is a gastroenterologist, and I said, I've got this unbelievable abdominal pain. I just got off an airplane coming in from San Francisco, and he said, you need to go to the emergency department right now. And I was like, I don't want to go to the ED. I'm going to have to wait. It's going to be awful. He said, no, you really need to go. This is important. And thank goodness he did, because I think he may have saved my life.
Well, and plus, he called you on his cell phone while he was dropping his son off at college, so you can tell that's dedication.
Absolutely. So, Christopher, I can relate to your story. I didn't have a ruptured appendicitis, but I did need abdominal surgery, and it all went well. Thank you for your call. Okay, Terry, we got to wrap it up. We are just about out of time. Do you have a last-minute email message that you want to share?
I don't.
Oh, okay.
I do, actually, Joe. The last-minute email message is from a dental physician who says his practice is an integrative dental medicine emerging model. I spend a lot of time with my patients to educate them on their overall health interactions. Patients respond to a thorough understanding physiologically of what their recommended course of care is. A lot of physicians say take this med or do this without being sure that the patient understands why or how the treatment plan will work. 2 of my physicians didn't know the mechanism of action for a medicine they recommended. They said, just take it, it works. In my opinion, this is not right.
And, we forget that dentistry is also really important when it comes to attitude. If your dentist looks in your mouth and goes, you haven't been flossing, you're a bad patient, that's not going to...
Nobody wants to hear that.
No.
You probably aren't going to go back very soon.
No, you won't. I saw my dentist this week. He was very reassuring.
That's so good. We want to thank you for listening and for calling in your stories and sharing them. Thanks to our guests today, Carrie Leibowitz of Stanford University and Dr. Michael Stang of Duke University Medical School and Duke Health Raleigh.
Lynn Siegel produced today's show. Pamela Alberta provided technical assistance. Al Wodarski is our engineer. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music by B.J. Liederman.
If you'd like to order today's show, 800-732-2334. It's show number 1165, or find it online at peoplespharmacy.com.
In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thank you for listening. Please join us again next week.
We hope you enjoyed this podcast. If so, please consider taking a minute to write a review on iTunes. And thanks for listening to The People's Pharmacy.